most shocking fact about thyroid cancer is that we are in the middle of global epidemic that isn't real, an epidemic created by our own medical tools, the ultrasound and the biopsy needle. The diagnosed incidence of thyroid cancer has tripled in recent decades, while the mortality rate has remained completely flat. This epidemic is almost entirely driven by two factors. High-resolution ultrasound, so we are now using ultrasound of the neck for countless reasons. For example, check carotid arteries, lymph nodes or parathyroid glands. These scans are incredibly good at finding tiny incidental thyroid nodules. And fine needle aspiration, FNA biopsy. Once a nodule is found, the standard procedure is to biopsy it with a very thin needle to see if it's a cancer. But the problem is that this process is unearthing a vast reservoir of tiny, slow-growing papillary thyroid microcarcinomas, tumors than less 1 centimeter. Autopsy studies shows that a huge percentage of the population, much more than 30%, has these occult cancers that would never have grown, spread or caused any harm during their lifetime. So the moment the biopsy needle pulls out cells that are labeled cancer, is a healthy person with a harmless incidental finding is transformed into cancer patient. This triggers a cascade of anxiety, further testing, and often a powerful urge to do something. So the biopsy result, papillary thyroid carcinoma, sound terrifying, but default response is a total thyroidectomy, surgical removal of the thyroid. This so-called cure for a non-threatening disease leaves the patient dependent on lifelong hormone replacement and carries risks of permanent complications, hypoparathyroidism, vocal cord damage. So the paradigm shift is to biopsy less. The modern evidence-based approach is to change the very first step. New guidelines from major medical societies now recommended not automatically biopsying small incidental thyroid nodules that have benign features on ultrasound. The goal is to avoid even making the diagnosis in the first place for these harmless lesions, thereby preventing the entire cascade of overtreatment. For cancers, so-called, they are diagnosed. The new paradigm is acute surveillance. The biopsy is the pivotal event in the man-made epidemic, is the action that turns a harmless anatomical variation into life-altering cancer diagnosis. The current revolution in thyroid cancer management is not about better surgery or radiation. It's about having the wisdom and courage to put down the biopsy needle for low-risk nodules. Stay blessed.